My name is Dr. Wan Muhammad bin Zakaria. I work as a medical officer in one of the health clinic in Malaysia. So my main job scope is to see TB patients every day, and I'm myself in charge to see TB patient in my clinic. As a medical officer, I see patients every day. So my workplace is also one of the high-risk place for infectious disease transmission. Because of this repeated exposure to the sick patient, it increased my risk to get TB and latent TB. Latent TB infection exists as a latent infection or inactive infection. So person infected with latent TB will not have any sign and symptoms. In the other name, that person actually act as a carrier of TB bacteria which exists as dormant or inactive in their body. Therefore, we as a medical officer sometimes having difficulty to convince individual with LTBI to seek treatment because externally they look healthy, they didn't have any specific sign and symptom. Therefore, without any concrete investigation, it's quite difficult for us sometimes to convince this patient, LTBI patient, to start treatment. We shouldn't stigmatize LTBI patient because they are not infectious. So we should encourage them to seek treatment to reduce their risk to get active TB later in life, which will be more complicated later. Previously, we only depend on MEN2 test to diagnose LTBI, but now with the development of IGRA, the interferon gamma release assay, we can identify and detect LTBI more accurately as IGRA is more superior compared to our previous test, MEN2 test, in terms of specificity and sensitivity. Previously, I only see TB patient and I treat them. But once I get the disease, I actually can experience myself how actually to become a TB patient, especially LTBI. Me myself also during the disease, I didn't manifest any sign and symptoms. But because of my awareness and my knowledge, I prefer to seek treatment because I know that LTBI can reactivate later in life, and we didn't know when the time comes, because if we develop active TB, we will definitely become more complicated and lead to more complication. That's why my choice, I would like to get treatment so that I can prevent further complication later in life. Based on my experience during my treatment course, it is not so difficult. I take my medication every day, and during my follow-up, I'm very compliant with my follow-up, and I am very fortunate that I didn't experience any side effects during the treatment. Now I'm very happy because I'm free from LTBI and I'm recovered. So I hope in the future I will not get any active TB because of my full compliance of LTBI treatment. During my journey of LTBI treatment, firstly, I've been diagnosed with LTBI from IGRA test. And after being diagnosed with LTBI, I proceed with counselling before treatment. I follow up for about 4 to 6 months during the course of treatment, and I managed to finish the treatment without any complication. Previously, for LTBI diagnosis and treatment, we only focus on MEN2. However, we have several problems in MEN2 test because MEN2 test, the specificity and the sensitivity is quite low. Besides that, it also affected by BCG vaccination. However, with the development of IGRA, the specific and sensitivity of IGRA towards LTBI diagnosis is very high. Furthermore, the result of IGRA also doesn't affect it with BCG vaccination. I really recommend a person out there to get LTBI treatment because based on previous published journal and research, LTBI can reactivate into active TB, which give more complication later in life. And with the treatment of LTBI, we can prevent the risk of TB reactivation later in life. And furthermore, in the future, we hope that with the implementation of LTBI treatment in our country, we can further reduce the incidence rate of TB in Malaysia, as mentioned by the mission of anti-TB strategy WHO, to reduce about 95% of incidence rate TB in Malaysia. We hope we can achieve that by the year 2035.
Hyogen.
Sample to inside.